The question number 1, a client with the primary hypothyroidism has taken levothyroxine for 1 year. So hypothyroidism patient, right? It is the thyroid disease, hypo or hyperthyroidism. Hypothyroidism, everybody know that T3 and T4 go down, right? But TSS is going up. Let me recap it, my friend. This patient has a hypothyroidism. In case of hypothyroidism, the T3 and T4, I said this T3 and T4 going down, but TSS should go up. This is the normal pathology occur in hypothyroidism. In case of hyperthyroidism, T3 and T4 go up, but TSS go down. Why it is occur, I'm going to explain this pathology right now. But first of all, let me clear something. So the keyword, the patient has a hypothyroidism. Because of hypothyroidism, patient taking the medication, this is called levothyroxine. Levothyroxine, other name is called Synthroid. They reduce the TSS or increase the T3, T4, levothyroxine, right? So laboratory results showing the still patient have a high level of TSS. Then what should take? Teaching what is most important, educate your patient. Number 1, I said a new prescription will issue for decrease the dose of. No, it is not a question to reduce the doses. Either we need more dose because still it is not control. In case of hypothyroidism, what are the treatment goal? Treatment goal increase the T3, T4 level and decrease the TSS level. But still it is increase the TSS. So the doses is not accurate, right? So second option, so 1 is not a choice. Discontinue levothyroxine, never. Why we will discontinue? Because my patients still have the problem, right? So I said hypothyroidism, T3, T4 low, but TSS go up. So if the TSS go up, we has to increase the dose, never discontinue. Number 3 option, they said start taking your levothyroxine with dietary fiber. There are 2 points every student should know for NCLEX board exam. One point is levothyroxine, when you admit to the patient, we could check the vital sign, especially the pulse rate. If we get the pulse rate is more than 110, means tachycardia, better to hold the medication. Let me recap it. So hold for the pulse if greater than 110 beat per minute. Point number 1. Point number 2, this medication, when you give the patient, educate your patient or teach your patient, it takes 1 week It takes 1 week to start the work. Okay. Also, it is important this medication better to take in the morning. Better to take in the morning. When you read this levothyroxine, you know the hypothyroidism, the drug's name is profile thiouracil, shortly called PTU, for hyperthyroidism. So anyway, so better to take this medication before food and at the morning time for better output. Number 4, you should need to get this new prescription, fill it up and increase the dose. Yes, because I said normal target is T3, T4 supposed to increase or bring normal, and TS is supposed to go down, but this patient showing TSS is high, so I need more doses to adjust the problem, right? So hypothyroidism, what are the pathology? What are the pathology, I said? So everybody know that hypothyroidism or hyperthyroidism is a disease of thyroid gland, but thyroid gland controlled by the hypothalamus and pituitary. You can see this is the picture of the brain, and this area is called hypothalamus, and this is the pituitary. Hypothalamus secrete thyroid stimulating hormone, and this thyroid stimulating hormone work on the pituitary gland. This is the picture showing the pituitary gland. Basically, this is actually located inside the brain. Hypothalamus and pituitary both inside the brain. We are going to make it bigger size here. So hypothalamus secrete TRH, means thyroid stimulating hormone, that work on pituitary gland, and pituitary gland secrete thyroid releasing hormone, and thyroid releasing hormone work on the thyroid gland and secrete T3, T4. So if your body do not have enough T3, T4, your brain get a feedback signal from thyroid gland, and hypothalamus secrete TRH, and this TRH work on the pituitary gland for more TSS, and more TSS can try to work, but like your thyroid tissue does not work or resistant to TSS, or you do not have enough ingredient to produce the TSS, but your brain is constantly getting signal and they're releasing TSS. So this is the reason hypothalamus patient T3, T4 is down, but if you are not get correct, again T3, TS level go down, brain gets signal, they secrete more TRH, and TRH work on pituitary gland, and pituitary gland secrete more thyroid stimulating hormone, and this hormone work on the thyroid gland and try to release T3, T4, but maybe because of the bodily system they are not compensate. Let me read this explanation here. Levothyroxine, other name is called Synthroid. They basically synthetic T4, other name. Thyroid hormone replaces the drugs. That is the most common treatment of hypothyroidism. Here, little bit I want to recap. The NCLEX board frequently asks what are the sign and symptom of hypothyroidism. I said easy way to remember the hypo, PO, means everything slow, right? Hypo, everything slow, or low, or cold. The three terminology. T3, T4 is low, metabolism is slow, right? And patient feel cold, right? Cold intolerance. Also, other problem, weight is increased, constipation, or slurring of speech, depression, bradycardia, brittle nail and hair loss. Basic signs symptom. So they said a condition which thyroid hormone deficit and slow the metabolic rate slow. The primary hypothyroidism deficit occurred due to the problem in thyroid gland, maybe thyroid gland tissue damage, resistant, does not produce the hormone. What are the hormone? 3, T3, 4. TSS is replaced from the pituitary and stimulate the thyroid gland to secrete T3, T4. And it is occur in case of primary hypothyroidism. Primary hypothyroidism. So hypothyroidism, when hypothyroidism in the adult person, we call myxedema. When hypothyroidism is infant, it is called cretinism, right? So now next, TSS released from pituitary and stimulate the thyroid gland to secrete T34. In primary hypothyroidism, when thyroid does not synthesize enough T34, the pituitary release additional TSS to compensate. This result is a high level of circulatory TSS because body tried to compensate by its own way. Client and prescribed levothyroxine is the management to increase the T3, T4. And they also reduce the TSS level, right? So what are the educational objectives from this question? In primary hypothyroidism, the deficit occur due to problem in the thyroid gland. Primary thyroid gland. Secondary cause may be problem in the pituitary, maybe problem in hypothalamus. That is the secondary cause. When the thyroid does not synthesize enough T34, the pituitary release additional TSS to compensate. This result is a high level of circulatory TSS, and levothyroxine is used to start increase the lead of euthyroid. So euthyroid means the normal thyroid. Normal thyroid. So levothyroxine we use for hypothyroidism. Easy way to remember, my friend. Hypothyroidism, the spelling Hypo, hypo, and medication the levothyroxine, LEVO, right? Easy way to remember. In case of hyperthyroidism, I said, we use the medication name is called PTU. PTU. PTU stand for profile thiouracil. And hypothyroidism, levothyroxine. Easy to remember. Hypo, levo. Question number 2. A client with a chronic kidney disease, shortly called CKD. So kidney does not work. In case of CKD, has received the continuous intravenous infusion of heparin for 5 days. So CKD patient under the treatment with IV heparin, the nurse received the coagulation studies and medication admin record below, which prescription should the nurse question arise. In NCLEX board, sometimes question like this. If you click in the button, and you can get the table like this. In this table is shown laboratory result and medication, what we give to the patient. What are the medication this patient are taking? This patient taking apotin. The real name of this is called apotin alpha, vitamin K, sodium polystyrate sulfonate, and warfarin. There are 4 medication taken by this patient, and time is there, right? So then laboratory results showing activated partial thromboplastin time 53 seconds and international normalized ratio 2.3. So if any patient has to take warfarin or heparin, we always check the bleeding time, clotting time, or partial thromboplastin time, or activated partial thromboplastin time. But for the warfarin or heparin, most accurate indicator are APTT. It's called activated partial thromboplastin, right? It is most accurate marker. So APTT is considered a more sensitive version of PTT. PTT stands for partial thromboplastin time. APTT means activated partial thromboplastin time. Is the more accurate, I'd say. So we used to monitor the patient response to heparin therapy. The reference range for APP, reference range I said, usually it is 30 to 40 seconds. And the reference range for PTT, 60 to 70 seconds. So this 53 after taking the anticoagulant heparin. It is the marker. And international normalized ratio also 2 to 3 fold. So it is also the normal range, I said. So if I go back the 4 option for this patient, keep in mind your patient CKD diagnosed, taking infusion of heparin. Now there are 4 options. Which one question arise? Maybe wrong or right. Patient are taking apotin. Your patient has a CKD. CKD patient easily develop anemia, and apotin alpha we give for prevent the anemia basically. Okay. So I said when patient have diagnosed by CKD, it is very common they develop the anemia. But apotin medication is used to treat anemia. Anemia means low red blood cell count. Basically, apotin we prescribed for CKD in people or patient with a long-term serious chronic kidney disease. Okay, so apotin is a good medication in case of CKD patient. Second drugs is called sodium polystyrene sulfonate. CKD patient also developed hyperkalemia. Because of hyperkalemia, we give them sodium polystyrene sulfonate to use to treat hyperkalemia. Hyperkalemia stands for increase the amount of potassium in the body. And this sodium polystyrene sulfonate remove excess potassium from the body, right? It works by removing excess potassium from the body. So also it is a good medication for CKD patient to remove the potassium. And already in the question mentioning heparin is going on. So heparin or number 4 is warfarin. Both are anticoagulant, right? Both are anticoagulant. They prevent the blood clot. Difference between heparin and warfarin, heparin is injectable only. They prevent to conversion of prothrombin to thrombin. But warfarin we give orally, and they also has an effect to prevent the blood clot. Other name of warfarin is called coumadin. So the patient who taking the heparin, they also could take the warfarin to prepare the patient, and both can prevent the blood clot, right? This is the function is similar almost for this patient. I want to recap something because it is very important about warfarin and heparin. It's called, I mean, when you work in the hospital, you have to keep it in mind, and also it is important to educate your patient. Okay, so I said you teach the patient monitor for sign of bleeding if your patient take heparin or warfarin. Basically for warfarin, this one or coumadin, you educate your patient, limit the some food like cabbage or green leafy vegetables. Okay, and also better to avoid alcohol, right? Also in case of heparin or warfarin, we could monitor the PTT or INR. It is called partial thromboplastin time and international normalized ratio. So warfarin also is good medication to prevent the blood clot, but vitamin K is an antidote of heparin and warfarin. They work blockages the activities of warfarin or heparin. So it is the question why you give something totally opposite of warfarin, because your patient is CKD already taking the heparin. So why you give them something to stoppage the heparin activities? So vitamin K is the antidote. A question come and we have to hold and talk to the healthcare provider. Let me read their explanation. Vitamin K is a fat-soluble vitamin. Okay, it means as an antidote of warfarin. But when need, you give them. But if you do not need, why you stop the function of the warfarin? This medication prescribed should be questioned as vitamin K release the anticoagulant effect of warfarin here. And what are the education objectives? Anticoagulant stop the thrombus formation by interfere with coagulation cascade or pathway. Parental heparin and oral warfarin affect the clotting cascade in different way. Therefore, the 5 days overlap for two drugs is required. This allows the warfarin to reach the therapeutic level. So, warfarin and heparin work together for this patient. So, the question is here, we are going to a short review. A home health nurse visit a client 2 weeks after discharge from hospital, right? So therefore the 5 days overlap, no, the client experience acute myocardial infarction, shortly called MI. So there are two information I want to focus. The myocardial infarction, this is the continued process of angina. Most of the patient has a history of chronic heart disease like hypertension or angina, because if angina is untreated, it leads to unstable angina, and unstable angina, if untreated, lead to develop MI. Myocardial infarction patient most commonly present with the sign like pain over the chest or left fifth intercostal space area. Patient feel diaphoresis or dyspnea. Dysarrhythmia also common, and also patient feel feelings of fear and anxiety. Pallor, cyanosis, all also common. I said when you're dealing with the myocardial infarction patient, if you take a good medical history, you can find it out some of the risk factor that causes myocardial infarction. Some of the risk factor are modifiable, some are non-modifiable. Example, family history, not possible to modify. Like gender, because men and female, you do not change it. The MI is most common in the man and it is less in the female because of their estrogen and progesterone hormone. But after menopause, men and female are both equal risks to develop MI. So what are the other factors that we can change or modify? Like one is atherosclerosis or elevated the cholesterol level, smoking, hypertension, obesity, physical inactivities, impaired glucose tolerance, or stress. If you know how to deal with them, then you can stop to develop MI. So now, patient in this question, a patient has a history of MI. He or she were at the hospital, now at home, and you go to visit this patient. Whom medication are listed below? Which symptom reported by the client in most concerned to the nurse? First of all, bruising easily, fatigue, feeling depressed, and muscle cramp. So before to go, the medication list, here's the important first. So fatigue, it is the common sign after MI. It takes time to recover. Feeling depressed, also common sign after a major disease like MI, right? But question came, why bruising and why muscle cramping? There are two reasons of muscle cramp. If we are not yet give a look on the medication history, but I said without this, there are two reasons maybe. One is patient were in hospital, maybe immobilization and develop chance of deep vein thrombosis. One. Another cause, what are the medication patient are taking for MI? Maybe because of medication also can start develop the muscle cramp, right? So this patient, the medication history said, patient taking aspirin, right? So here's something I want to share with you. The aspirin is a non-steroidal anti-inflammatory medication, but aspirin has a property to protect your heart, right? So aspirin not only used as antipyretics that reduce the pain or fever, but they have an effect on or over your heart, right? So here, and also it is important, we have to know aspirin, it is good to take with food. But aspirin sometimes can cause some kind of bleeding spot. If we see anything like this, we have to notify healthcare provider. Okay, so aspirin is friendly drugs if anybody have a MI. So another medication we use, I mean, this patient has taken, this is called clopidogrel. And here the clopidogrel, this medication, it is antiplatelet, means they prevent the clot formation by blocking the platelet aggregation, like what the blood thinner will do, Warfarin or Heparin. Clopidogrel, sometimes we use the ticlopidine, okay, also in the same effect, okay. But keep in mind, if any patient has a allergic reaction to aspirin or ibuprofen or naproxen, it is good to avoid the clopidogrel. And also it is also very important, if your patient are taking clopidogrel and if they need any kind of surgical operation, it is good to hold 7 to 10 days before any kind of major surgical operation. So also it is important, use some caution during activities require the alertness, such as driving a car dealing with heavy machineries. It's like aspirin. If we see any kind of bleeding or monitor for the sign of bleeding, we could inform healthcare provider. And do not use any other over-the-counter medication if your patient take aspirin or clopidogrel for heart problem or MI. Do not use. Okay. And other medication most common, everybody know, this is called beta blocker, right? So beta blocker like metoprolol. So beta blocker, atenolol, propranolol, metoprolol, or carbidiol, any kind of medication we use. Basically, beta blocker, metoprolol management for hypertension or angina pectoris or congestive heart failure or prevent MI. This is the reason we use. Other medication we use, this patient use is called furosemide. Furosemide are the diuretics, right? Furosemide are the diuretics. So any kind of diuretics, if you prescribed your patient, always check electrolyte, because diuretics excrete or spell out excreted sodium and fluid, and patient easily developed hypokalemia or hyperkalemia. Hypo or hyper, I said, right? This patient take furosemide. Other drugs we use in the same category called torsemide or bumetanide. So furosemide is a loop diuretic or potassium depleting, means they expel out potassium from the body. They causes hypokalemia. They causes hypotension. They causes hyponatremia, right? So I said the furosemide can cause hypotension, hypokalemia, or hyponatremia. So when you give the furosemide, always check the electrolyte. Because of hypokalemia, patient develop the cramping of the muscle. So it is the question arise about the furosemide. Another medication we use for diuretics is called thiazide diuretics. The difference between furosemide or thiazide diuretics, furosemide reduce sodium, reduce potassium, reduce blood pressure, but thiazide causes potassium. Thiazide also causes hypotension, hypokalemia, hyponatremia. Same basically. Loop diuretics and thiazide diuretics both can causes imbalance of electrolyte. So we definitely check the electrolyte level. Another medication this patient take called lisinopril. Lisinopril is an anti-hypertensive medication. It is called angiotensin converting enzyme inhibitor. It is used for treatment of hypertension or treatment of heart failure. Okay. But lisinopril protect the kidney function in the patient with a diabetic. Very important. Okay. So it is good if we check the kidney function, and also lisinopril not to give the pregnant women. It is a contraindication in pregnancy. Another medication is atorvastatin. It is the lipid lowering agents, right? So there are a group of lipid lowering agents we discuss in other classes, right? So steroid sometimes react with diuretics. Is good to not to give together. Steroid, I said. Sorry, atorvastatin, statin or cholesterol lowering agents. So let me read it. The nurse would not most concerned with the client report to the muscle cramp on the leg. This could be sign of hypokalemia that causes by the use of diuretics like furosemide. So furosemide may be cause of leg cramping. They react with the statin like atorvastatin. Hypokalemia manifest with the muscle cramp or weakness or paralysis. Typically start with leg cramping or leg muscle cramping. Hypokalemia could be danger in the client due to the possible arrhythmias, right? So arrhythmia lead to the cardiac arrest. So we have to correct the hypokalemia. How we have to correct it? Monitor the electrolyte level or potassium level and give your patient high potassium diet. High potassium food including leafy green vegetables, fish or white beans, avocado, potato, milk, mushroom, banana. This is actually high potassium containing food. If the potassium level is normal, atorvastatin may be response for muscle cramp. Maybe. The nurse should recognize the muscle cramp in the leg as a possible sign of hypokalemia. This is the note we learn from here, right? And muscle cramp should be reported to the healthcare provider in anticipation of checking the potassium level. Okay, and added the potassium supplement or potassium rich food.